Hi, I'm Jackie Mitchell with your Senior Advantage team, and I'm here with Lynn Degenhart of Mercy Home Healthcare. We spoke before, and we talked about some very serious new equipment, technology in the home healthcare arena.
Right.
And so I'm here to ask, what kind of things have you brought me today that will
gosh.
help?
First of all, thank you for having me again. As you said in our last conversation, we talked a lot about home health and services that are provided in the home, and we kind of touched on a little bit of technology in the home. So I am here today with all kinds of cool gadgets. Basically, technology in the home has taken off probably within the last, I would say, 8 to 10 years, where we're bringing in equipment or tools that are able to keep someone healthy and safely in their home. So we're going to go through all these today.
How would I know if, my family member or someone that I knew needs this kind of equipment?
Chances are, as you and I talked earlier, if there is a continuing issue or a health-related issue or a safety issue, chances are in this day and time, there is technology. I mean, a lot of us have smartphones and smart homes, so there's things that, are incorporated that way. But basically anyone that might have, say, a chronic illness, a heart condition, maybe a little unsteady walking, some frequent falls, basically anything that would be health related, there probably is a technological solution for it.
So how do I get it?
Good question. Some of the equipment here today you can purchase on your own and utilize, and I'll go through those. Others you have to be, like for example, on service with Mercy Home Health. You have to be one of our patients in order to qualify for the technology that I'm going to show you. Other technologies can be either purchased or rented through the Red Cross, and the Red Cross of Philadelphia was gracious enough to drive some of that equipment up to me today to show you.
So there are different types of technology then for
Yeah.
all kinds of illnesses and different scenes within the home, right?
Correct. Probably our biggest and most successful one, and I think the most effective one in today's conversation, is what we call telehealth. Telehealth is electronic monitoring equipment that is put into the home. It monitors, it's usually for people that do have those chronic illnesses or a heart condition, or someone that has some pulmonary issues, breathing issues, really at high risk for rehospitalizations. And as we touched on before, this rehospitalization is a huge, huge issue right now for hospitals, for healthcare. Basically what's happening is the government and the insurance and Medicare is saying, listen, you need to do a good job discharging the patients from the hospital. And we don't want to see those patients coming back through those hospital doors within 30 days. So you better figure out a way to do that. So the hospitals are incorporating great case management, great oversight, post-follow-up care, and home care is part of that. Now our telehealth is really cool. I brought some stuff here today. But basically telehealth is not billable to any insurance company, and we do not bill the patient. So this is something that our company does for free, if you will. They're on service with us, receiving, our nursing, our physical therapy, things like that. But we put this equipment in the home to keep them safe in the home, to keep them healthy in the home, to keep them out of the hospitals. And it also has a great ability to teach them how to manage their disease. And I'll kind of get into that a little bit. So typically, these are for cardiac patients, chronic ill patients, patients with COPD, emphysema. So one of the things I have on the table, which isn't always a nice thing for some of us, is a scale. So this scale is put into the home, and it monitors the weight on a daily basis. And the scale is wide enough that if someone would be on a walker, they can kind of wheel over it and get their weight calculated. But one thing I probably need to back up a little bit is, how is this stuff monitored? How does this work? You get on a scale, what happens? There is actually a telestation that is also put into the home. This is kind of the hub. It's hooked up to a phone line if you have a phone, or it has the capability for a cell phone hookup. So everything is kind of communicated to the patient through here. There's a screen. And then also it's transmitted through the phone line to us. And basically what happens is the weight, the blood pressure, the pulse ox, the heart rhythms are sent through the phone line to a cardiac care nurse every day. 365 days a year, doesn't matter. So what we're able to see is if a patient perhaps from yesterday to today got on the scale and weighed themselves and they gained, a pound. That might not be too big of an issue, but when you have someone that has cardiac or breathing problems, that might be the beginning of something. So then maybe we don't call them that day, but maybe the next day we see they've gained another pound or 2 pounds. Well, now you know there's something brewing. So typically what would happen without telehealth is this patient would call the doctor. Doctor would say, go to the emergency room. Well, you've just totally, blown out the rehospitalization. So what we'll do is we'll call the patient, see what's going on. I mean, sometimes it's as simple as, well, I had a half a bag of Doritos yesterday watching the Phillies and some soda, and that's the reason for, the weight gain. Sometimes, most often, it is a health-related issue. So we're able to intervene immediately. So at that point, what we would do is we would send a nurse out, or perhaps we would have to call the doctor, the cardiologist, or the primary care, and maybe have some medication administered, for whatever reason. Or maybe they really do, need to go to the emergency room. But there's so many steps that are taken prior to going to the hospital, which is, the goal of telehealth. And one of the astounding facts, is every month we keep statistics on what are the national averages for rehospitalization, say within 30 days, what are the state averages, and what are your averages. The national average for rehospitalizations for those with CHF is 24%, 24. If telehealth is involved, that drops to 3.9.
Wow.
It's a 20% drop.
That's incredible.
Because you're empowering the patient, they're being monitored by a cardiac nurse, you're interacting with the family, with the physician. It's all about keeping people safe in their home. So before I get too far off on my tangent.
More people should be using this.
Yes. And
absolutely.
Part of the issues with telehealth is the fact that not every home care asks, or offers it. So that's something that, the viewers here have to ask, or maybe chat with their doctor. Do you think this technology would be beneficial to me? Mm-hmm. So it's a decision you and your family doctor, your cardiologist have to make. So we have the scale, we have the console, and this is the blood pressure cuff and reader. So this is fitted when our nurse goes in initially and sets up telehealth. She fits this so it's easy for the patient, to get on and off the arm. And, sometimes if somebody has some limited mobility, maybe a stroke or maybe some cognitive deficits, as long as there's a caregiver in the home that can help answer the questions and input the data and put the blood pressure cuff on, that's fine. But the patient has to be able to do it or have someone there that can help them with that. And then the other component to the telehealth is what we call the pulse ox, which measures the blood oxygen. So this I'll put it down real quick, but this goes on the finger. And if you go to the doctor, you get that quite a bit. They want to see how much oxygen is in your blood. So the weight, it also monitors your heart rate. And if you are a diabetic, it also allows you to enter your sugar levels. So we're monitoring all those things at one time. But telehealth, I think right now, is named one of the top 3 technological, and I'm probably going to use the wrong word, but one of the most important technological finds in medicine. One of the top 3 that just came out a couple weeks ago. And you can see why. If you can stop rehospitalizations from 24% to 3.9%, be healthy, manage your disease, why wouldn't you do it? So I think we have some other ones to talk about too. What's next on my list, Jackie?
Real-time ProTime. What is that, and who would use it?
Okay. Real-time ProTime is for people, again, some people that have some cardiac issues or people that maybe had some recent surgery. This is for people that are on Coumadin or warfarin, a blood thinner. Okay. So for those in the audience that are familiar with that, what happens is you usually have to have your blood drawn twice a week, things like Tuesdays, Thursdays, Mondays, Thursdays, somewhere in there. So now you have a needle stick. They have to send the blood to the lab to get the results. They call it a PT-INR. And then maybe a couple days later, then your doctor's notified, and they might have to change your dosage, because with Coumadin, it's very important that that dosage be exact, because, you know, obviously.
My father was on it, yes.
So you know, and you know how many blood sticks he had to have. This basically, a couple drops of blood from the finger, and it goes, it's almost like a glucometer. So the little strip goes in there, and it gives you an instant PT-INR reading. So what that does is now, while our nurse is there, she's calling the doctor and saying, this is the PT-INR, do you want to adjust the Coumadin? So it's almost instantaneous. It's not waiting for the specimen to get to the lab to run it, the lab to call you, for you to call the doctor. So this is really a great tool, and a lot of the orthopedic surgeons really want a company that has this in their service.
Well, that's wonderful. That's something that my father could have used instead of having to run into the lab.
Right.
Every, he only went like every 2 weeks, so he was very lucky.
He's lucky.
But it was for a long time he was on that. Okay, how about vital stim speech therapy?
Vital stim speech therapy.
I've never heard of that. What is it?
This is probably, besides telehealth, this is probably the most intriguing thing to me. It is for, oops, and there goes my little things, excuse me, but that's okay. This is for people that are having swallowing difficulties. A lot of times you'll hear people have dysphagia, which means they can't keep food down, or they can't keep liquids down. And in very awful occasions, and they have to have a feeding tube or a PEG tube put in. VitalStim is technology that actually retrains the muscles in the throat to swallow and keep food down. Now, I will say I am very proud that Mercy Home Health still is the only home health agency in southeastern Pennsylvania where all our speech therapists are certified in VitalStim speech therapy. So what happens is a lot of people are familiar with electrical stim, like for physical therapy. So if you're having some physical therapy, they'll put the little electrodes on, and it starts working, and you start doing your thing, and it just accelerates your rehab. VitalStim is very similar in that after we speak with your physician, you might have to have a swallow study, but electrodes are strategically placed on your throat muscles, and I dropped them, otherwise I'd show you. So what happens is these little electrodes, these little leads, start pulsing, and they start working those muscles. Muscles are doing good. Right. And then, in conjunction with traditional speech therapy, it's training those muscles to keep food down. It's training it to keep liquid down. We are very proud to say we've actually had 2 of our patients come off of feeding tubes because of VitalStim.
So it helps them swallow, is what you're saying?
Correct.
Oh, my father could have used that too.
I know. I feel so bad now.
Yeah, I'm glad there's something.
But a lot of it is, just the new technologies that are coming out now. It might not have been available then. And I know we have some other things I want to get to real quick.
How about the emergency alert system?
Yeah.
Let's talk about that.
This is really cool. A lot of people have these little emergency alert systems in the home. So it's if you fall or something like that, you press a button. I like Lifeline for a couple of reasons. I think their service is excellent, but you are not signing a contract and you're not purchasing the equipment. It's just a monthly rental. And the Red Cross of Philadelphia was nice enough to give me this unit. But basically what it does is, God forbid if someone would fall in the home, they have a couple different options. They have little buttons that they can wear around their neck. So, great. If you fall and you remember, to press the button, it's awesome. If you fall and you're a little disoriented or, God forbid, unconscious, Lifeline also has a component that is an auto detect. So it's a different button, and what it does is it measures the velocity of a fall. So if it sees this high velocity, it automatically triggers that emergency response. So at that point, then they would come through the console and say, there's a Lifeline alert, are you okay? They kind of triage it first. But that is a great component for people that might not remember to press the button. And then the last thing is probably my most exciting thing, but I don't have an example of it, is medication management. Again, the Red Cross and other home care agencies do offer what is called an iMed machine. And I have a picture of it right here. It's an automatic medication dispensing machine. It holds 60 doses of medications, and it is automatically dispensed. And why this is important is there is over $3.5 billion spent in emergency rooms and hospital stays due to medication mismanagement. And I'm just as guilty. Sometimes I forget that I took my medicine or I didn't take it. And for seniors and as we get older, those medications are crucial and the timing of them is crucial.
Very.
So what iMed is what I call it. It holds 60 doses and the medication is in like little salad dressing cups. They are loaded into this machine and the machine is programmed by a family member or a nurse and it is closed and it is locked. So when it's time to take your medication, the machine starts flashing and it starts talking. So all you have to do is you see a little red button here, you press that red button and your medication comes down this little slide and you take your medication and you're good to go. So it's great
wonderful.
Technology.
It is. My father needed one of those too, but okay. I'm so glad that they're finally addressing the issues of seniors because this is something that's a very huge problem in this country. I thank you for coming in this afternoon.
You're welcome. Thank you.
What a wonderful array of product you've brought us.
Oh, my goodies.
And technology. Thank you very much.